Hello everyone. With this diagram, we'll try to learn about what are the factors that are going to affect the cardiac output. The cardiac output can be written as heart rate into stroke volume. The factors affecting the heart rate are the autonomic nervous system, that is sympathetic and parasympathetic activity. Whereas stroke volume depends on the preload, that is nothing but the Frank-Starling's law, and afterload and the myocardial contractility. Myocardial contractility mainly depends on the mass of the myometrium, and it also depends on the ongoing sympathetic activity and the hormones. Whereas afterload is the load acting on the contracting myocardium, where it depends on mainly the peripheral resistance, and peripheral resistance is determined by the diameter of the arterial system and the sympathetic activity. Whereas preload mainly depends on the venous return, the atrial contraction, and the ventricular compliance. Ventricular compliance is the stretchability of the myocardium. More the stretchability, more the blood accommodated, and more the preload. Whereas atrial contraction forms 30% of the filling of the ventricles. Whereas venous return, it depends on the total blood volume, which is around 5 liters. More the blood volume, more the venous return. Depends on the cardiac pump, with a turgo force, with a fronte force. With a turgo is the ability of a myocardium to contract and to push the blood in forward direction, whereas with a fronte force is the negative suction force created by the atria, which drains the blood into the atrium. It all depends on the muscle pump and the respiratory pump, where inspiration increases the venous return and expiration decreases the venous return. Again, it depends on the venous tone, which is depend on the sympathetic activity, where it increases the sympathetic tone and increases the venous return. It also depends on the posture, where standing posture decreases the venous return and decreases the cardiac output.